Good morning, everybody, and thank you for joining this special legislative briefing focused on California's aging and disability landscape. My name is Maria Kalina. I'm the Executive Director of the California Collaborative for Long-Term Services and Supports. The California Collaborative is a cohort of nearly, next slide, Nancy. The California Collaborative is a cohort of nearly 60 state and regional organizations that work together to foster understanding about California's system of care for older and disabled adults, educate policymakers about the needs and realities of seniors and people with disabilities, develop policy solutions and recommendations for improvement, and support members in their advocacy through information sharing and building connections. Before we get started, I'd like to run through several housekeeping items. First, I just want to highlight that this briefing will feature a combination of presentations as well as smaller breakout sessions for discussion. We recommend speaker view for presentations and gallery view for the breakout sessions that'll follow. And you can adjust your view at any time by selecting the little square icon in your top right-hand corner. Also, please be aware that you have the ability to turn on your camera and unmute your microphone. So we would love to see your camera on, but we do ask that everyone keeps their microphones muted unless they're speaking to limit background noise and disruptions. Chat is also open, and I fully support side dialogues and commentary as we roll through today's program. And perhaps you can all help me make sure that that chat is open and working with a quick icebreaker. So I'll ask folks who are joining us today, if you could drop in the chat your response to this question, which is, if you could instantly pick up any new skill, what would it be and why? Is that chat working? Great. Okay. So while that chat is heating up, I just wanted to flag that this briefing is being closed captioned. If you'd like to enable closed captions, please select the transcript icon on your toolbar. And lastly, we'll be running through several slides during the presentation component of today's program. And all of the graphics and charts that we showcase are part of California Collaborative's Aging and Disability Fast Facts publication, which will be available electronically as well as in print via a tabletop flipbook. For those joining today, we'll be following up with a link to download the electronic version, and I'll be circling the Capitol or swing space rather in short order to deliver the tabletop flipbooks to legislative offices. And with that, I also want to make sure that we acknowledge our philanthropic partner, the SCAN Foundation. Without their support, this publication could not have been made possible, and we really appreciate the partnership and leadership from the SCAN Foundation as they work to advance a coordinated and easily navigated system of high-quality services for older adults that preserve dignity and independence. Great. Well, with that, I do have some sad news, which is that Assembly Member Dr. Jasneet Bains is not able to join us. There was a last-minute scheduling challenge, and I believe she's stuck in another meeting. However, I'm so excited to welcome Liz Fuller. Liz, are you with us?
I am. Can you hear me?
Yes. Let me spotlight you and let you take it away.
Please.
Jump in when you're ready.
Yeah, well, just good morning to everyone. I'm certainly not as enticing nor exciting as the chair of aging and long-term care, but if you were able to live stream our hearing yesterday, we did a hearing yesterday on the master plan for aging. Some oversight in that area is part of the legislation, part of the executive order as it was written. We had a hearing yesterday where Director DeMorris, Kevin Prindeville, and Dr. Mohanty really shared the value of the past work of the MPA and how we move forward. But you also would have heard the commitment from Dr. Bains as a health practitioner, but also with her deep understanding of what caregiving looks like, what it means to be someone who has had to balance the needs of being a caregiver and a working woman. She was a caregiver to her grandmother, and yesterday marked about 5 years of her passing. And she really had kind of an emotional moment in the hearing of saying it's a real point of reflection. It's a point of where she is now in her life and the opportunities that she has to bring forward change in this space, but also who she is and has been as a caregiver. So I myself have been a caregiver at different times in my life. I was a caregiver during the pandemic. I think that both of us together are going to bring our passion and commitment in this space. So I'm very, very excited to work with Dr. Baines. I also think she has a very unique perspective of representing a chronically underserved part of California, and how we often talk about what services and supports exist on a statewide level and forget that when we talk about things on a statewide level, we miss the opportunities to talk about what regions look like. And so it's kind of that math equation of when you're looking at what the averages are versus really where some of the one-off statistical needs are still very, very important. So I'm sorry that I had to pinch hit today, but you are my people. You are a group that I'm so pleased to work with and feel like I found I loved the job that I did before this, but I couldn't have been happier to find my home here in the aging and disability space. So my door is always open. I know that I've slowly been able to ensure that Dr. Baines is meeting with some of the critical groups that need to meet with her, and there are more to meet with. And she's very, very committed in this space. We do have another hearing that I know we're committed to doing around the master plan and how it impacts underserved and neglected communities. And that'll be in May. Very strategically placed just after May Revise, that gives us that opportunity to have a public forum to perhaps discuss some things that may or may not be missing from a document that'll come out around the 10th of May. So always look forward to working with you all. And I know that anything that the collaborative does just enriches the space and always educates me. So Maria, thank you for allowing me to come into this space quickly. Maria, also, I want to just give credit to you. She and I spoke about 9:59. So I appreciate you always being able to work with me and understanding that the legislative process also includes a very unpredictable legislative calendar. So thank you.
Very true. Thank you so much, Liz, for stepping in. It's always a pleasure to have you. And I hope you hang out for the rest of the session today.
Mm-hmm.
Perfect. Great to have you on board. On behalf of the collaborative, again, thank you for your time. And we are really looking forward to Dr. Baines' leadership and partnership as we work towards building a California for all ages and abilities. Okay, we're going to turn to the lightning round presentation section of the agenda, and presenters, given the very short time allotment, please just be ready, be on standby, be ready to jump in and start your presentation as soon as you see your introductory slide. And I'm going to serve as your timekeeper to ensure that we stick to about 30 minutes and have ample time for the breakout discussions that will follow. Now, here's another change up on the agenda. Michelle Matter from the SCAN Foundation was going to kick us off by providing an overview of aging and disability demographics. And this morning we learned that she's not feeling well. So Michelle, if you're happen to be watching, we're sending you lots and lots of well wishes. And I'm going to do my absolute best to try to wade through this piece of the agenda before turning it over to my colleagues to carry us forward. So just to start us off, California is in the midst of a demographic shift. Our aging population is growing at a much faster rate than any other age group. By 2030, which is just 7 years from now, over 25% of Californians will be 60 and older. And by 2060, California will have more older adults than any other age category. The Golden State also has a significant population of disabled adults. In fact, there are nearly 7 million adults living with a disability in California, which equates to roughly 1 in 4 Californians. Disabilities are not always visible, and it's likely that we interact with a number of individuals who are living with a disability that we know nothing about. In California, mobility and cognition, and that includes developmental disability, are the most prominent functional disability types. Next slide. Thank you. While disability can absolutely occur at any age, the prevalence increases as we grow older. Roughly 26% of all disabled individuals in California are between the ages of 65 and 74. 9% are between the ages of 21 to 64, and 10% are age 20 and younger. As the number of older adults in California grows, so will the number of individuals with disabilities. And according to the Legislative Analyst's Office, California will experience a 160% increase in the number of older adults between 2015 and 2060. Aging has a very strong intersection with equity, and I know my colleagues will elaborate on that as well. Our older adult population is becoming more racially and ethnically diverse. In 2010, older adults, as seen in this graph, were predominantly white. And you can see a shift occurring over time. By 2030, white non-Hispanics will no longer represent the majority. And by 2060, California will have a clear majority among older people of color. At the same time, Californians are living longer lives. Life expectancy has been on the rise since 1950, with the average life expectancy, and this is pre-pandemic, being 81.4 years. The Stanford Center on Longevity predicts that life expectancy will continue to climb. I don't know how many of you have littles, but if you have toddlers running around, an interesting data point is that as many as half of today's 5-year-olds will live to be 100 years old. There's a small caveat on the previous slide that I wanted to be sure to highlight. While in general, life expectancy has been on a steady climb since the 1950s, Californians did lose an average of about 3 years of life expectancy as a result of the COVID-19 pandemic. And that impact was not even across the board. For Hispanics, life expectancy declined by nearly 6 years. Blacks experienced nearly 4 years of decline, and Asian Californians lost roughly 3 years. And by comparison, the state's white population lost nearly 2 years. So we, as a state, continue to struggle with long-standing systemic inequities that were clearly highlighted by the COVID-19 pandemic. And I think, Hagar, this is where I pass it off to you to take over.
Hey, thank you. Good morning. I'm going to be covering a little bit of background information on long-term services and supports. So you can go ahead. Long-term services and supports, or LTSS, is a term that describes a wide range of services that are provided to older adults and people with disabilities, including assistance with healthcare needs, activities of daily living, and personal needs. California's LTSS are provided through different programs in a variety of settings, and each program provides a different menu or a combination of services. Among them are personal care services, which provide support for activities of daily living, transportation to medical appointments and community services, care coordination and case management, which help gain access to needed medical, social, educational, and other services, meal preparation and grocery shopping, wound care, housekeeping like light cleaning, errands, and medication management, and respite care, which is short-term care for enrollees as a relief to primary caregivers. Next slide. Long-term services can be provided in a variety of settings. They can range from the recipient's home, where they can receive personal care services to help with activities of daily living and through a variety of caregiving models, or community-based settings such as adult day health service centers that provide individuals requiring nursing facility care with social and caregiving support. And these services are essential to help older adults and adults with disabilities with significant care needs continue to live in their home and in their communities. Assisted living services are somewhat of a hybrid model, which require individuals to move from their home into a more supported environment that continues to be community integrated residence. Services are provided in licensed board and cares called residential care facilities or adult residential facilities, and they have 24-hour on-site staff, or through public subsidized housing through home health agencies. But unlike nursing homes, these facilities provide a home-like environment, independence, and community integration and access. And finally, individuals can also receive their long-term care in facilities, in facility-based settings like nursing homes and skilled nursing facilities and intermediate nursing facilities. These are institutional settings that are not community integrated. Unfortunately, California's long-term care system is fragmented across government agencies, the Department of Healthcare Services, Social Services, Department of Aging, Department of Mental Services. As a result, program pathways are fragmented as well, requiring individuals to communicate with county social service agencies, waiver agencies, managed care organizations, and other organizations to learn about and apply for each program separately. This fragmentation creates barriers to access with significant consequences for individuals needing these services, including poor health outcomes and unnecessary hospitalizations. And fragmentation and barriers in access often translates into disparities in access and utilization, especially based on race, ethnicity, and English proficiency. Next slide. And California's vast healthcare delivery initiative, CalAIM, is an ambitious initiative for the integration of the state's healthcare delivery and is an effort to reduce that fragmentation. This is a multi-year statewide plan to standardize managed care enrollment and benefits, to provide person-centered care and address social determinants of health to reduce disparities and inequities for Medi-Cal managed care enrollees. Included in these services are provision of some long-term services and supports, including enhanced care management and community supports, adult day health, and long-term institutional care. When I think now Debbie is going to move us forward.
Great. Thank you. And good morning, everyone. And thank you so much for taking time out of your busy schedules to prepare yourselves to help us lift up a California for all. As Hagar mentioned, we are finally designing systems to meet the needs of populations that have been woefully underserved and rarely considered in the planning of our built-in systems environments. We gained 3 decades of life expectancy last century and did Zippo to plan for it. But that's changing, and it must, because those needing services are growing rapidly, as you are seeing today. I recall attending an annual SCAN Foundation Summit one year and hearing from one of the state departments related to planning and finance that California's age and disability statistics are far higher than any other state in our nation. And I was blown away. And what have we done differently to plan for this? Well, until recently, not a whole lot. As we age, and you know we're an aging nation, we begin to need support with our daily life, whether that includes transportation, shopping, cleaning, cooking, or with personal care, such as assistance with using the bathroom and showering or bathing. Did you know that 1.3 million older Californians live alone, and that number is growing? This means they can't just rely on a spouse or sibling or child or friend to support them as their needs increase. And this may be one of the contributing factors to a state where in 2017, 37,000 nursing home residents were deemed to have low-level care needs, according to a study by AARP. This is unacceptable and clearly an unintended consequence of lack of planning for this exponentially growing population. We've organically created a system that is an institutionally biased poverty pipeline. People spend down all of their assets until they no longer can afford to live independently and end up in skilled nursing facilities. And even if you don't passionately love elders like I do, you must see that taxpayer dollars of $85,000 a year to keep someone in a place they oftentimes don't want or need to be, compared to $18,000 in Medi-Cal spending community, makes 0 sense. So we know that people need care. And we know that many folks don't know that there are programs and services that provide that care. So it comes down to creating systems and outreach that are infused in our everyday lives and infiltrate our systems of care. How is it we know that we have to go to the DMV to get our driver's license, but we don't know at what point we qualify for Medi-Cal, or that we could qualify for in-home care to help us with shopping, housekeeping, meal preparation, and personal care. Right now, it seems like a matter of luck. If you're fortunate to have someone in your family or circle of friends who works for an area agency on aging or an independent living center, or the two of them joining together and creating an aging and disability resource connection, then you're golden. You will get the support of social workers at an information and assistance program, and perhaps learn about a low-income PG&E plan, or phones with loud volume and large numbers, or that there's a day program to engage your wife that also supports groups for you for free. And that maybe someone can get support with assistive technology to get back into the workforce after an accident. At this point, referrals typically come from senior centers, a local Alzheimer's program, or through friends and family. It is rare, but it does happen on occasion that a physician or discharge planner refers folks to the independent living center or Alzheimer's organization or association after an acute episode in a hospital. Those healthcare workers are experts in traditional healthcare, not community-based care. So there is this divide in knowledge, and that creates serious access issues, as does our radical shortage in the caregiver workforce. And here to dive more into that reality is Jenna Shankman from the Family Caregiver Alliance.
Thank you, Debbie. Next slide, please. So first, I want to highlight the vast majority of care for older adults and people with disabilities are provided by unpaid family and friends. So maybe that's a spouse, a partner, an adult child, a neighbor. So all told, there's 4.7 million family caregivers estimated in California, and they provide at least $63 billion of value of unpaid care, but that the cost of long-term supports and services, which I believe will be discussed more further, keeps rising. So this number might be higher as well. And a lot of family caregivers are women and women of color, and they sometimes are providing care for children as well, something we call the sandwich generation. And so the cost of providing care is very important, and something that has a lot of meaning to a lot of family caregivers, but it can also be really taxing emotionally and financially, with an average cost of between $7,000 and $13,000 out of pocket for expenses that family caregivers invest. Next slide, please. And so in addition to family caregivers, there's of course people who also work in this field, direct care workers who can provide hands-on daily long-term assistance. They either work privately in the home or in different community settings that Debbie mentioned, and congregate facilities. This tends to be a lower wage job, and it's largely held by women, almost 50% who are immigrants, and more than 3/4 who are people of color. And next slide, please. So unfortunately, there's a real crisis of number of people who are available to provide this direct care work. It's an occupation with the most job openings, and there has been a mass sort of exodus even of like who is available to provide direct care work, in part because of the pandemic. So in early 2020, there was 4.5 million Americans who were paid to provide elder care. But in the first 24 months of the pandemic, more than 240,000 of those workers left the profession, leading to elder care being one of the hardest hit industries by the pandemic. And as you heard from the slides about demographics, there's an increased number of older adults above 60, above 80, who are likely going to need these supports, which we get into a little bit more in the next slide. So there's a growing demand that we know is coming with more Californians who will have self-care limitations. There's fewer family caregivers that are expected to be available as well. AARP has an interesting study that showed that in 2010, a number of potential caregivers per adult over 80 was a ratio of 7 potential caregivers per person. By 2030, that ratio is only going to be 4 potential caregivers per person over 80. And then by 2050, it's going to go down to 1 to 3. So other solutions are definitely important. Things like expanding chosen family for paid family leave, which is a current bill, and also just things that we can do to increase the number of people who are in the direct care field. All right, next slide, please.
So good morning, everybody. I'm Nina Weiler-Harwell with AARP California, and I'm going to talk today about the cost of long-term supports and services, or LTSS, especially relative to the median income of an older household. So first of all, and I think a lot of us, many of us on here have already been caregivers, have experienced the cost of care, but it's extremely expensive. And certainly expensive relative to the standard median income in California, but even more so relative to, and this is according to the 2020 LTSS scorecard. There'll be a new one out later this year. But according to that, the average household 65 plus has an income of about just over $54,000. So then compare that median income to the cost that you see here. And they are far beyond the means of an elderly household, let alone the means of any household in this country, in this state. So if we could go to the next slide. And I should go back to one of the notes on the slide was even the fact that while many older Californians do possess equity in their homes, trying to sell that home to pay for that care and then find something affordable in California, of course, is its own challenge. So we know that LTSS costs are largely paid for by Medicaid, also known as Medi-Cal in California. These costs are really from during the pandemic. So we see that there, of course, was a large bump in funding through the federal government, some of which is going to wind down. But the actual out-of-pocket costs, for example, by individuals to pay for this is 14% of all costs are covered by individual out-of-pocket. Medicare, while some do believe that Medicare will actually cover LTSS, it's limited, it's time limited, and it may not be available to somebody who hasn't had a qualifying event to enable them to access the care or enable them to access it for more than 90 or 100 days. As noted, Medi-Cal or Medicaid does cover the bulk, but we also rely on other means such as private insurance, such as out-of-pocket, as noted, and other sources. Next slide, please. So as I already noted, there is a common consumer misconception that Medicare pays for LTSS. AARP does try to educate our members and remind them consistently that Medicare is not the game. It's not the whole kit and caboodle to pay for this, but those misconceptions still exist. And we will hear from members here that will say, well, Medicare will cover it, but actually it doesn't. We also know that Medi-Cal is limited to individuals at or below 138% of poverty, which this year is about $20,000. And I will tell you that not infrequently I hear from members who are maybe surviving on Social Security only for say 24,000, 22, 26, even 30. They don't qualify for Medicaid or Medi-Cal. So therefore, they have to look to other means, whether that's private pay, whether that's a loved one, which is often the case, or for the rare individual who can afford and sustain the cost of long-term care insurance, There are going to really be very few individuals in California that can actually expect that their LTSS will be covered by Medi-Cal. Do we have another slide? I will now turn it over to Jason to talk a bit about the next portion of our presentation.
Thank you so much. Hey, everybody. My name is Jason Sullivan Halpern. I'm really excited to be here with you today talking about these important issues in the aging and disability space. And in terms of like talking about the different types of living situations that aging and disabled folks find themselves in, it's really important for us to keep the housing, affordable housing and homeless issues in focus. So, and right now, the older and disabled adult poverty rate outpaces the state average. In California, the current average poverty rate is 11.7%. And among disabled Californians, it's 26.4%, which is nearly double the average for the state. California has the highest percent of older adults living at or below the poverty level, and it also has the highest percent of homeless older adults as well. Next slide. Nearly half of Californians unhoused adults are aged 50 years old or older. 35% of rented households with residents aged 65 or older spend more than half of their income on rent. And if we look a little bit closer into how this applies to persons with disabilities, in 2020, 42% of people experiencing homelessness reported a disabling condition, and 32% of Californians experienced chronic homelessness exacerbated by a disability. And I want to also like point out that as the rate of poverty increases and I'm sorry, my notes are tripped out for me a little bit. I also want to point out like some of the inequities inherent. So there's like an element of inequity within inequity, is that when we talk about the numbers of people that are unhoused, if we look at a segment of California, for example, LA County, although 39% of older adults who are experiencing homelessness are Black, they only represent 8% of the population of LA County, for example. It's really hard for us to talk about this without putting it in context of how much rents are raising as well. So between December 2017 and September 2022, the median rent for newly leased units across the board in California rose nearly 32%. And that's far outpacing, wages and what people can afford living on a fixed income. In terms of how much is covered through public benefits, I just want to also point out that in 2020, the fair market value of a studio apartment in all of California's counties was more than 50% of what the maximum SSI grant would be. And in 22 counties in California, it completely exceeded the amount that people are eligible for if they receive the maximum SSI grants. There was a survey that was done by a nonprofit in the last couple of years that found that 56% of older adults who responded said that they could use an additional $300 a month to be housing secure. And among those who were in that category where they weren't meeting their basic housing needs with the income that they have, about 11% of those who had been surveyed said that they went without food or medication in order to make rent that month. And among those who had been homeless, about 45% of respondents had gone without food or medication in order to meet some of their housing needs. So I think just to kind of summarize all of this, it's really, we don't not only talking about like the economic effects of this, but We also have to look at some of the downstream like health effects as well. So there was a study done by UCSF where they followed hundreds of unhoused persons for a period of almost 5 years. And they found that those that were unhoused at an age of 50 years or older were 60% more likely to die early. And people that remained homeless that remained chronically homeless after age 50 were 80% more likely to die earlier than they otherwise would. So definitely we want to point out that the scope of the problem of affordable housing and homelessness is increasing as California's older population increases. There's an element of inequity within inequity, which is disabled and BIPOC Californians are hit hardest by homelessness and the affordable housing crisis, and the downstream effects of homelessness and affordable housing need to be emphasized. It's not just the economic consequences, but the health consequences that result from not having your basic health need, housing needs met. Thank you. Next slide, next presenter.
Good morning again, Nina Weiler Harwell, ARP California. I'm going to just hit some points about the so-called missing middle. Previously, I had really already previewed this by noting, for example, what the median income for 65 plus couple was. And the median income, by the way, for a California household in general is $87,000, which sounds great, except that the cost of living here is so high. So we see that many individuals who would otherwise perhaps be struggling with their costs simply do not qualify for Medi-Cal. So again, under 138% of poverty, we get calls all the time from members who just don't even know how to begin to piece together their own care. They simply can't afford it and they can't qualify. The next tier of individuals are people who may have to quote unquote spend down in order to qualify for Medi-Cal, and really risk their own finances in order to qualify, or perhaps qualify for a Medi-Cal share of costs, which comes with its own challenges, although hopefully that's changing soon. And we may say that individuals who are at 400% of poverty are just fine, but there are, again, so many challenges in the state in terms of affordability, and individuals here in this bracket cannot qualify for Medi-Cal. These costs, even the 650% is well below the cost of an annual stay, the cost of a nursing home stay. I do want to say, also as the slide notes, 89% will have insufficient resources to private pay assisted living without selling their homes. And there was one other point I did want to make, and that's about long-term care insurance. Long-term care insurance is a product that simply is inaccessible to the vast majority of Californians, so it's not an answer. Only 4.2% of Californians over 40 have purchased long-term care insurance. And we're also very, I think many of us, well, you may not be, cognizant of some of the problems in that market, in that rates can be raised, product can be downgraded, and it's kind of a take it or leave it scenario for, say, somebody who's been paying it for decades. And is suddenly told either switch to this lesser plan, this plan that provides fewer services at a higher cost, or say goodbye to all the money you've already shelled out every month to pay for this insurance. So we really do have an issue here where we have to think well beyond folks in poverty, but folks within the middle class, and how we're going to assist them in and help people get a leg up in terms of taking care of the cost of long-term supports and services, especially as the number of older and disabled Californians continue to increase. And do we have another slide? Now I'm going to turn to Dan. Dan, good morning, Dan.
Good morning, everyone. My name is Dan Okenfuss, and I'm the Public Policy Manager for the California Foundation for Independent Living Centers, or CFILC. and we are a nonprofit organization based here in Sacramento, representing 25 independent living centers across the state. And our mission is to increase access and equal opportunity for people with disabilities by building the capacity of our ILCs. I'm going to talk to you about the Master Plan for Aging. And its theme is building a California for all ages and disabilities. The MPA, as you'll hear a lot through this presentation, serves as a blueprint to prepare California for the coming demographic changes that you heard already about the tsunami of people getting older and needing care and resources over the next decade. The MPA affirms the priority of the health and well-being of older Californians and people with disabilities as a blueprint for state government, local government, the private sector, and philanthropy to prepare the state for the coming demographic changes and continue California's leadership in aging, disability, and equity. It's comprised of 5 bold goals, 23 strategies, and over 200 initiatives aimed at building a California for all ages and abilities by 2030. It is in detail here. I'll talk over about the 5 goals. Sorry, previous slide. The 5 goals for the Master Plan Aging are as follows. Goal 1, housing for all stages and ages. It means we will live where we choose as we age in communities that are age, disability, and climate and disaster ready. And we are targeting millions of new housing options for us to age well. We're also targeting options for people to live comfortably in their own homes, which, as we've already talked about, is much lesser than skilled nurse, a much lower cost for the state to have options for people to live in their own homes to receive care. Goal 2 is health reimagined. We will have access to the services we need to live at home in our communities and to improve our quality of life. Goal 3 is inclusion and equity, not isolation. We will have lifelong opportunities for work, volunteering, engagement, and leadership, and we're protected from isolation, discrimination, abuse, neglect, and exploitation. So the target is to keep increasing life satisfaction as we age. Goal 4 of the MPA is caregiving that works. We will be prepared for and supported through the rewards and challenges for caring of our aging loved ones. And our target is 1 million high-quality caregiving jobs. And finally, goal 5, affording aging. We will have economic security for as long as we live. And the target is to close the equity gap and increase elder economic sufficiency. Next slide, please. The Master Plan Aging has a variety of resources for tracking our progress through this ambitious plan. There is on the QR code on the slide here, you can scan and that'll get you to the California Department of Aging's website. And there you'll find an implementation tracker where you can monitor implementation activities by searching for progress updates on each of the 5 goals of the MPA. There's also a data dashboard where you'll see real-time data on public accessible, user-friendly, and routinely updated places where you can see the goals of the MPA being played out. And there's also a local playbook. It's not just state, it's not just nonprofits, it's also local governments that are also involved in providing resources for local age and disability friendly planning. And with that, it concludes our presentation, and thank you. And I enjoy the rest of the presentation, please.
Thank you, Dan. Thank you all so much. Fantastic. We got through that really quickly. I did want to highlight one additional thing, just knowing that we have legislative staff who serve in district offices with us today, that the California Department of Aging recently released an RFP that would provide funding for local age and disability friendly planning. And I'm going to drop that link in the chat, but I encourage you all to check that out. Feel free to reach out to us if you have any questions. We're happy to connect you. We're happy to talk about it, and really just appreciate this opportunity from the Department of Aging. And look at that, I accidentally sent the link directly to Judy and not to everybody. So there we go, fixed. Now we're going to turn to the breakout sessions. We have 3 breakout sessions. The first one is focused on caregiving, which will be facilitated or co-facilitated by Dr. Donna Benton, the USC Family Caregiver Support Center, and Jenna Shankman from the Family Caregiver Alliance. This session is both about family and friend unpaid caregivers, as well as California's direct care workforce. Our next breakout session, number 2, is on affordability, co-facilitated by Jared Giarusso, the Government Affairs Director at Alzheimer's Association, as well as Carol Schwartzlander, the Executive Director of the California Commission on Aging. This is focused on affordability more broadly, so certainly we've had quite a bit of conversation about affordability of services that they will touch on, but also affording basic needs like housing and nutrition and healthcare, all of those things. And our last breakout session is on aging in place, so keeping folks in the community, in their homes to the extent possible. This session will be co-facilitated by Debbie Toth, who you've already heard from, as well as Jeff Tom, who's president of the California Council on the Blind. And let me open those up. You should see a little pop-up and you should be able to select which session you want to jump into. We'll have roughly about 35 minutes before I pull everybody back into the main session. These are really just coffee talks. This is an opportunity to get to know the stakeholder community, have a back and forth dialogue. So I really hope that you all will turn on your cameras. We don't bite, we're a really friendly group, and engage in the dialogue, engage in the conversation. Okay, so here we go, opening all the rooms. If anybody has a hard time getting into their room of choice, just hang back and I can put you in there once we've, let folks get into their rooms. So no worries, happy to support. And it looks like most everybody is back. So I just want to leave us with some closing thoughts and an invitation for legislative staff that are joining us today. I know bandwidth is very tight all around, and I'm incredibly grateful to have everybody who was able to join us for today's session. I hope that you all walk away with a better feel for some of the challenges facing our older and disabled adults, or at the very least that you had an opportunity to hobnob with some of the California Collaborative's deeply knowledgeable members. I know Dan was kind enough to take on the task of talking about the master plan for aging earlier in the program, but I really want to highlight it one more time. If you're looking for ways to support older and disabled adults, I encourage you to check out the MPA and familiarize yourself with both ongoing efforts, but also opportunities to build on those efforts to really ensure that California is a state that supports and values people of all ages and abilities. There's a lot of momentum behind the master plan for aging, and we're making significant strides at the state level while also building out locally. There are 3 counties who have implemented a local action plan. We have roughly 29 counties who are in a planning phase, and many, many more who are working to engage local elected officials, community members, community-based organizations, and other stakeholders in a dialogue around systems change for older and disabled adults, which is absolutely needed. And please don't hesitate to reach out to the California Collaborative if there are ways that we can support your work. I'm more than happy to connect you with our in-house experts. We can brainstorm and organize some site visits so you can check out these programs and services in action. I toured Choice in Aging a couple months ago, and it was so impactful. It really is wonderful to see it up close and personal. Happy to dig up data. Really, we're sort of up for anything. And we absolutely value your partnership and look forward to continued engagement as we work towards a California for all. Please note that we will absolutely circulate all of the data, all of the graphics included in today's program. You will receive a link to download an electronic version of the Aging and Disability Fast Facts publication, which is where we pulled all of that from. And I'll also be stopping by legislative offices in Sacramento to drop off printed copies of the Aging and Disability Fast Facts, which are sort of in a tabletop flip book, so they can kind of just hang out by your desk. And we hope that you hang on to them because we do plan to update inserts, add new inserts as data becomes available, And we really do see this tool as a living and breathing access point for strong and easily accessible data. And with that, please don't be shy. Let us know what sort of information might be helpful. We love feedback. We love to serve. And again, we really, really appreciate your partnership. I hope you all enjoy the rest of your day. And thank you, everybody, for joining us.
Great job, Maria. Thank you.
Thank you, Nina. Bye, everybody.